Good evening and thank you for joining us. A staffing crisis continues to grip hospitals across the Northwest, but so far this summer, ERs have remained open after some closures back in the spring.
Well, this comes despite the fact that ER patient volumes are on the rise. Kurt Black reports on the creativity and hard work that's so far kept the doors open.
A month ago, Margaret Kochner, Memorial Hospital CEO Sue LeBeau, said she wasn't sure how she'd be able to keep the emergency department open in the face of serious staffing shortages. Since then, the ER visits have increased, but the doors haven't closed. LeBeau says it has taken creativity and plenty of hard work, with doctors in some cases working 36-hour shifts.
It was really a lot of pulling together, a lot of stretching, and not easy to do. We achieved it. Not sustainable, though. This is not something that they'll be able to do day in, day out, month in, month out.
LeBeau says primary care has suffered, with local doctors reducing their clinic hours in order to staff the ER. And she says that's happening across the region.
We're decimating primary care to protect emergency services. But in the long term, we're going to create more challenges in emergency services because we are removing access to preventive care and to early care for patients.
LeBeau believes that a lack of access to primary care, in part due to COVID, is already contributing to the increase in ER visits.
And I think it may be an accumulation of things that had been ignored during early COVID that now are more severe and calling for attention. Mental health and addictions is one of those examples.
LeBeau credits the collaboration between the region's hospitals, agencies, and doctors for keeping the ER running so far.
Nothing happens in isolation, even if we are in isolated regions. We know that we depend on each other, and so there's that sense of we'll try as best we can to pull through things together.
Looking forward, LeBeau says there will only be 2 physicians in Red Lake for much of August, and overnight ER closures are a possibility later in the month, adding she appreciates the public's patience and understanding in the face of longer wait times. Kurt Black, TBT News.